Top Med Talk.
Welcome to Top Med Talk Digest. I'm your host, Nick Majerison, and on today's Digest, we have Desiree Chappell with the Roundtable blog. In this clip, she's in conversation with Dr Neil Seeley, Chief of Anesthesia for Cancer Treatment Centers of America, and Dr Michael Scott, Professor of Anesthesiology at Virginia Commonwealth University and Professor at the University of Pennsylvania. In this piece, they speak about what drove enhanced recovery for them and how outcomes have improved.
Top Med Talk.
What really drove enhanced recovery for us was not the short lengths of stay, it was actually the cancer outcomes. Because we collected the data and we had a national data set, we knew back in about 2009 that we were, for the same type of cancer and patient population, we were getting significantly improved cancer outcomes. This was multifactorial. We looked into it. It's both the fact that we had uncomplicated surgery, because we know complications can drive cancer, poor cancer outcome, but also we realised that we were sending our patients to mop up chemotherapy basically sooner. And also the other thing is we had very good results in our primary liver resections, and we published on that as well in the BJS, where we had one of the lowest morbidity, mortality, and yet it's still the lowest length of stay. So it is interesting that enhanced recovery in different ways can lead to actually affecting life expectancy and cancer outcomes, both directly and indirectly.
Dr. Seeley, when you were looking at enhanced recovery pathways for your patients, was this a piece of literature that you used, and how has that affected protocol development and actually implementation of enhanced recovery in your own practice?
Well, sure. The European literature really drove our practice. We looked at all the literature that had been developed many years ago in Europe and looked at what we could do then to jumpstart our program by replicating what had already been proven to be successful in Europe. The thing for an anesthesiologist that is such a wonderful feeling when we apply the enhanced recovery principles is that for once we can show that we can make a difference, not just for the patient in the PACU, which used to be the territorial boundary of where we ended our concerns, and now we're seeing that we can affect the patient post-operatively in the whole post-operative period, and then, as Mike is suggesting, improving their outcome long-term. So it's exciting for me.
Top Med Talk.
That clip is part of a longer conversation which you can find either by going to topmedtalk.com or searching on your podcaster for Enhanced Recovery for Liver Resection Patients. That's Enhanced Recovery for Liver Resection Patients. If you haven't already done so, don't forget to subscribe to topmedtalk.com.